What we often see in autoimmunity are certain parts of the immune system are hyperactive. Those are the attacking the tissues, producing the autoantibodies. And other parts are actually suppressed, like the part that's supposed to handle chronic infections. There are maybe 4 supplements we can talk about at a high level that I think are very important in autoimmune disease and chronic inflammation. I want to reframe autoimmune disease as ultimately a disease of the immune system. So it's only one condition, which is immune system dysregulation.
We're in the middle right now of an epidemic when it comes to autoimmune disease. What is going on here?
Yes, I think you're absolutely right, Jesse. We're seeing skyrocketing incidence of autoimmune disease. It's the fastest growing category of disease. By some estimates, 1 in 5 Americans are dealing with some form of it. And globally, hundreds of millions of people are struggling with it. And I think it's because we have this perfect storm of risk factors that has come together, especially 5 drivers of autoimmunity and inflammation. And that's what I have put together in my Tiger protocol, which are the 5 factors are toxins, infections, gut dysfunction, eating right, so nutrition, and then rest and managing stress. So I think all of those areas are sort of under attack by modern diet and lifestyle. And I think that's the reason why.
I heard you mention the word there, inflammation, and you talked about the 5 drivers. So do I have it correct thinking that these 5 drivers add to our inflammation burden, which then starts autoimmune disease? If, obviously it depends on the person and genetic factors and a lot of different stuff, but basically because of that inflammation, the body succumbs to an autoimmune condition over time?
Yes, I think chronic inflammation is one of the biggest underlying mechanisms for all autoimmune disease, and in fact, our modern chronic disease epidemic. Heart disease, obesity, diabetes. It's hard to find a condition where inflammation is not an issue. I think the other factor, which is very important for autoimmune diseases, is oxidative stress. So oxidative stress refers to the normal metabolic functions that lead to waste products every day in the body. But these factors like toxins, infections, gut microbiome imbalances, stress, all of those increase oxidative stress in the body. And our body's antidote to that is antioxidants. And so that's why studies have shown patients with autoimmune disease tend to be pretty low in their antioxidant status because they have high levels of oxidative stress. And I think these 5 drivers of autoimmunity are contributing not only to inflammation, but to significant oxidative stress.
And if we follow those 2 different pillars down, inflammation, oxidative stress, to the physiology of what's happening in the body, is it acting on similar mechanisms within the body to cause autoimmunity, or are they 2 different silos?
Actually, they're different. So with inflammation, a couple of key pathways that are involved are the 5-lipoxygenase pathway, also known as 5-LOX. And then there's NF-kappa B, which is a growth factor that kind of drives inflammation. And the great news is there are things that can counteract both of these pathways. Like, for example, with NF-kappa B, curcumin or turmeric extract is one of the best ways to address that. Yeah, but with oxidative stress, the mechanisms are different. It's more like, for example, in the body, the biggest, most important antioxidant is glutathione. And often there's a deficiency in glutathione because it gets used up to quench a lot of these free radicals from the high oxidative stress. So people are struggling with low glutathione levels and low antioxidant levels in the body. And diet and supplements are ways to address that area.
One thing I really like about your approach is the fact that you take 100+ autoimmune conditions and you're talking about them as a whole, rather than in classical medical doctor silo terms. We look at Hashimoto's, type 1 diabetes, and all of them are given these different doctors and different ways of treating them. What simplifies things and gets right to the root, I'm assuming it must be because we're addressing the root with all of these, And again, that comes to things like the inflammation and the oxidative stress, that we don't necessarily need to look at them as siloed entities.
Exactly.
It's good to have that diagnosis, but what I'm getting at is our treatment is going to be very similar.
Yes, exactly. And I think that's one of the challenges that patients with autoimmune disease face is that their specialist, whoever is assigned to treat their autoimmune disease, depends on the end organ that's damaged. So maybe endocrinologist if it's thyroid, gastroenterologist if it's the intestine, neurologist if it's the brain, like in MS. And often these specialists don't communicate with each other, and patients are stuck trying to put the pieces together. So I want to reframe autoimmune disease as ultimately a disease of the immune system. So it's only one condition, which is immune system dysregulation, but the end product of that can be really protean, 100 different diseases, depending on which tissue is damaged in the end. But we have to go upstream to the original dysfunction in the immune system.
So you did talk about coming down from the inflammation, the oxidative stress, to other variables that are underneath that. What is at the pinnacle root, if we had to distill it all the way down? Can we do that to one thing that's causing autoimmunity?
No. And I think that's part of the challenge with autoimmunity because in Western medicine, we like this kind of one mechanism, one drug, one disease model, which applies to certain diseases, but autoimmune disease is multifactorial. So all of these factors are pretty equally important, like the toxins, infections. The gut microbiome is huge. And within that, there's probably three main mechanisms we see. There's dysbiosis, which is bacterial overgrowth. There's a drop in diversity of the good bacteria. And there's increased intestinal permeability known as leaky gut. So these three are the hallmarks of gut dysfunction seen in autoimmunity. And then food and stress also are huge factors that drive these imbalances. So we can't bring it down to one, but at least we can bring it down to five. And then we know that addressing all of them is important in a multi-pronged approach.
Right. I understand that part of it. But when it comes to the actual physiology in the body, is there a way to bring it all down into a neat little package? Because we've said all these different things, glutathione's part of it, oxidative stress, inflammation. Is there a way to say we have this one root that with the 5 drivers, we're going to address it, but or is it too multifactorial to simplify it that way?
Yeah, I think you could say that it comes down to immune system dysregulation, and we have to be clear that the immune system is very complex, though, and by that it doesn't mean that the immune system is completely suppressed totally. So what we often see in autoimmunity are certain parts of the immune system are hyperactive. Those are the attacking the tissues, producing the autoantibodies. And other parts are actually suppressed, like the part that's supposed to handle chronic infections, which is why patients are often puzzled that, yes, I have an autoimmune disease. My immune system is supposed to be very hyperactive, but then I'm getting all these infections and, deal with like colds and flus and seem to be prone to infections. So I think that while we can say that immune system dysregulation is a factor, it's complex because there's certain parts that are too active and certain parts that are underactive, and we have to modulate the immune system. So improve the immunity that is intrinsic to fight infections, and then calm and reduce the autoimmunity that is part of the immune system as well.
I think it's really important we got into that. The fact that the immune system is so complex that part of it can be overactive, part of it can be underactive at the same time.
Right.
Let's talk about conventional treatment. So if somebody was to go to a conventional medical doctor with an autoimmune condition, and again, it's going to be probably a different doctor depending on what the condition is, and different doctors are going to have different treatments, but in a really general sense, what are doctors doing to treat autoimmune disease?
So They're prescribing medicines to calm the autoimmune process and reduce the attack on tissues, reduce the inflammation, reduce tissue damage. So there's two main categories of medicines that can be used. One are steroids, which are probably the strongest, most powerful immune suppressant. But the problem is they suppress the immune system across the board. So remember, we just talked about how with autoimmune disease, certain parts of the immune system are underactive. But if you're suppressing them further, then you get more at risk for even more serious infections. So steroids are generally tried to be used more short term. And then long term, it's mostly anti-inflammatory drugs and immune modulating drugs, a lot of which are injection based, like the Remicade, Humira, all of those categories that each target different aspects of the immune system. But the goal is really suppressing the autoimmune disease. And, medications can be life saving. They have an important role to play. Autoimmune disease cannot really be cured. So the goal is to get to the minimum number of medications, the minimum dosages, so that patients can achieve remission, which is where the condition becomes quiet. There's no symptoms. They feel good. They have normal quality of life. And they can maintain that with the lowest number of medicines so that if there's a flare up, they can then use those more powerful medications, which will work at that time because they, have been held in reserve until then.
The obvious thing that comes to mind as we talk about suppressing the immune system as a whole using a powerful drug is the fact that the immune system isn't going to be able to do its normal functions. So if we're just bringing it all the way down, it's not going to be able to detect things like cancer and destroy it before it becomes a problem. So I can see how, again, they have their role maybe in certain cases, maybe for certain periods of time. But for long-term care, you can see how that's going to cause its own array of complications.
Yes, exactly. And I like to use the metaphor of a car to think of the immune system in autoimmune disease. And what you have with the out of control inflammation is that the gas pedal is pressed down all the way to the floor, and the immune system, the car, is kind of out of control. So what Western medicines do is they slam on the brakes. So, very effective at slowing the car down, stopping the car, but they don't really do much to take the foot off the gas. And those are the underlying drivers, the root causes, which were responsible in the first place. So I think it's much more effective to do both. Yes, you hit the brakes and then take your foot off the gas so that when you cut back on those medicines, cut back on the braking process, then it's not immediately another flare up that occurs.
And I can see how in the natural health world, people can be just as guilty in another way where we're using different supplements to boost the immune system and always trying to boost it to fight different things.
Mm-hmm.
But what I gather from preparing for this is we're trying to modulate the immune system. Again, we talked about that factor that the immune system's not this one big on and off switch. There can be different parts of it that are highly active at one time while other parts are suppressed. So it's very complex. And what we're trying to do, correct me if I'm wrong, is to modulate that and have it running in a normal fashion.
That's exactly right. I think that's why it's always good to work with a practitioner when you're taking supplements or herbs, because you want to make sure you're doing the right things. For example, echinacea and astragalus are two herbs that kind of boost the immune system, but they do have more of a modulating effect. So you want to work with someone who's skilled to advise you on when to use which herb and supplement and for what length of time and for what purpose. So there's quite a involved science there.
So we opened up talking about the fact that autoimmune diseases are skyrocketing right now. For somebody tuning in, saying to themselves, I'm not feeling good, I have this and that going on, how do they determine if an autoimmune disease is at the root of that?
Well, I think the concept of the autoimmune spectrum is very important in that there is a mild part of the spectrum where people don't have a full-blown autoimmune disease yet, but they have non-specific symptoms like joint pain, fatigue, gut issues, brain fog, skin issues, non-specific to where they can't be diagnosed with a disease yet. But that is the beginning of the autoimmune process. And still, it does respond to addressing these 5 root causes, because the same drivers that cause autoimmune disease can be addressed to prevent it as well. Autoimmune disease can develop over 10, 20, 30 years based on the research. And so there's really opportunity for early intervention. It's much easier to prevent the disease or treat it in the early stages rather than treating it much later.
And for somebody who's having some of these symptoms and just kind of feeling off, is it worthwhile in the beginning to have some testing done of autoantibodies to determine what's going on in the body and then working from there, from that baseline?
Yes, I think that is a really good idea. And I think the autoimmune antibodies are often positive in these early stages. So I think the most extreme example with autoimmune disease is PBC, which is primary biliary cirrhosis, where the autoantibodies had been detected in the blood 25 years before the person was diagnosed with the disease. So sometimes, it could be 10 years, 15 years, but even more than 20 years, these antibodies show up pretty early on. And there are, ways to test them through regular labs. And as the disease progresses, usually the number of autoantibodies increases. So, for example, usually by the time someone is diagnosed with lupus, they have more than 100 different autoantibodies detectable in the blood. That's the condition with the most number. But in the early stages, it might be just 1 or 2, and then you have the clues that these are things you can work on, and these are areas you need to address.
So we know from a diagnosis standpoint, the antibodies or the autoantibodies are helpful to determine what's going on because it is such a continuum and it takes so long for full-blown autoimmune disease to take effect in the body, or at least it can. My question is, for somebody that is going to apply some of the stuff we're going to get into later and start treating that condition, how helpful are the autoantibodies and having that testing done on an ongoing basis to determine progress in treatment and seeing those come down?
I think that can be a helpful way to track because autoantibodies can be an effective barometer of the of autoimmune disease. And if you are noticing that the antibodies are dropping, they don't need to be checked frequently, maybe once every 6 or 12 months. But if you see that they're progressively declining, then you're on the right track because you're doing things that are bringing down those autoantibodies, bringing down the autoimmune process and the inflammation as a result of that.
And then coming back again to the fact that things can be so silent in the body for so long before full-blown autoimmune disease, I could see how it could be argued and beneficial even for somebody before they have symptoms to get that baseline and see if some early changes are happening with those autoantibodies.
Mm-hmm.
Also, the argument could be made that we should be living what we're going to be talking about before, even if we don't have anything going on. Like you said, it's preventative as well. But I think that information could be valuable to somebody to see where they're at today and then work from there.
Yes, I definitely agree. Yeah, I think checking autoantibodies has a key role to play. And, if you have an autoantibody, when you get tested for that, it doesn't guarantee that you're going to develop that autoimmune disease, but it does give you a clue about areas you can work on to, try to prevent the progression of that process.
All right, I want to take time now and work through the different drivers of autoimmune disease, starting with T, toxins. And you make it clear in the opening of your book that it's important when we address autoimmune disease, we follow that acronym of TIGER, starting with toxins. So start off talking about why, out of all the different areas to address, we want to begin with toxins.
Yes, there's a few reasons. One is that I think toxins are the most under-recognized root cause that are less addressed frequently. So even when I see patients who have seen other integrative or holistic practitioners, often not enough attention has been given to toxins. A second factor is that the toxin burden or toxic load in the body makes a difference. So later on in the protocol, for example, when you're healing infections or killing overgrown bacteria or yeast, there's a die-off reaction. So toxins are released, and then if you already have very high toxic burden, then that's when you start getting those what's called a Herxheimer reaction, where you feel terrible, flu-like symptoms, fatigue, weight loss, joint pains, brain fog. So all of those things can be minimized if you bring down the toxic burden first before going on to these other things that are going to be releasing toxins as they're addressed, like infections and the gut microbiome.
Well, let's move into the biggest area of toxins, actually biggest areas, and talk about where those are coming into the body.
Sure. So I like to break it down into a few categories. So one is food, second is water, third is the air, fourth is the home environment, and fifth are personal care products that you put on the skin. So I think in each of those areas, there are um, key toxins. So I found in my review of the research 20 different toxins, each of which are linked to increased risk of autoimmunity. Some of the big categories are heavy metals like mercury, lead, arsenic, and cadmium are four that are specifically associated with autoimmunity. And then you have endocrine disrupting chemicals. So it's a little bit of an alphabet soup, but you have PFCs, which includes PTFE and PFOA that's found in Teflon, the nonstick coating. We have PFAs, and then we have BPA. So a number of these are significant endocrine disrupting compounds. We also have pesticides of all types. Glyphosate may be the most well known, but other agricultural chemicals and pesticides as well are important. And then the hidden toxins are what people don't often realize. Like indoor air is often a source of significant toxins compared to air outside the house. So making sure your home is well ventilated, making sure you're greening your household chemicals, and addressing mold or mycotoxins that might be in the house. All those steps can be beneficial to reduce toxin exposure from air. And then finally, personal care products. Yeah, so that is a hidden source. Phthalates, BPA, parabens, all these things. So I like to refer people to the Environmental Working Group. They have a database. It's a nonprofit where you can find clean skincare products because whatever you put on your skin is going to be absorbed to some degree every day.
Let's talk about the food piece. You mentioned the 5 different categories that these toxins are coming in through. And obviously, this one is very foundational, something that we're doing multiple times a day and it's going to have a big impact. So other than the obvious of going organic, what are we looking for when it comes to toxins in our food?
Yes. So I think, as you said, the big one is to go organic, where you will automatically avoid GMO foods because those are not permitted in organic foods. But then, in addition, with autoimmunity, many other additives to food have been found to be important and contribute at least to leaky gut or inflammation or immune dysregulation. This includes additives like emulsifiers, preservatives. A lot of these are the ones that are found in processed foods. And that's the other big category because so much of our society now is processed foods are everywhere. They're a big part of the diet for most people. And often that's where these ingredients and additives that are food toxins can slip through. And then the other thing that it depends on the person, but food sensitivities. So there is with gluten sensitivity, that's on a spectrum. And for certain people, gluten can be toxic. in the literature that's called non-celiac gluten sensitivity, or NCGS, where a person doesn't have celiac disease, they test negative for the blood work, but they still react to gluten and as a toxin, and it causes inflammation, it causes fatigue, brain fog, various symptoms that have been reported in the literature. So that's important for some people as well.
All right. So big things I took from that are we're going to remove gluten, processed foods. We're going to stick with organic best we can. While we're on the diet piece, let's talk about if somebody is going to be battling or preventing. So that includes everybody. But let's talk about the diet you're recommending and what that looks like.
Sure. Yeah. So, and I think one other big category I would add is sugar, because that is the other thing that has been shown to worsen autoimmune disease. I'm not talking about sugar in fruits like fructose, because in fruits, it's together with phytochemicals and fiber, so it does not have a negative effect like naturally occurring sugars. But I'm talking about processed sugars, white sugar, high fructose corn syrup. Those have been shown to be inflammatory, and higher levels of intake is associated with more inflammation and more flare-ups in autoimmune disease. So so that's the other category I wanted to add. And in terms of my overall approach to diet, I break it down into two phases. One is the phase 1 diet, which is more of an elimination diet, where you eliminate gluten, dairy, eggs, soy, most legumes, even nuts and seeds. So it's fairly restrictive, but that's intended to be short term, maybe in the 6 to 8 week range. And then I walk people through an 8-week program for reintroduction, because my phase 2 diet, which is a long-term diet, is really about boosting the diversity of your microbiome and expanding the number of foods that you are including, because long-term, that is really important to ensure that your microbiome is robust and as diverse as possible, because that's a key factor with longevity and also reduced risk of autoimmune disease and other chronic diseases. So that's my long-term phase 2 diet.
For a lot of people that have found their way to this interview and say they've had an autoimmune condition for a period of time and they've tried to battle it within the natural realm, they're going to have come across the AIP diet. This is the classical, within that natural realm, elimination diet people apply to fighting autoimmune disease. So what I'm curious, how does your phase 1, which is the most limiting, compare to that AIP diet?
So I think there's a couple of key differences. So one is that in my phase 1 diet, I do allow gluten-free grains like rice and so for buckwheat. Because what I've seen clinically is that it's pretty rare that people react to these other grains like rice and buckwheat that are gluten-free and generally, very good sources of like phytochemicals, fiber, starch, all the things that we need. So I don't exclude those. And then within the category of legumes, I actually allow mung beans. So mung beans are unique. That's a type of lentil. It's used in Ayurveda as a medicine because mung beans are part of this dish called khichdi, which is made with rice and mung beans and spices. That is, it's actually very healing for the gut, and it's considered medicinal in Ayurveda. And really never seen sensitivity to mung beans, whereas people are often sensitive to other legumes. And so that also opens up the dietary options. And so in other ways, I think it is similar to what the AIP diet removes, but I've included a little bit more options. So I think that makes it easier for people to sustain.
One of the things that you mentioned specifically in your diet that you recommend to people is cabbage juice. So this is a unique one. Talk about why that's in the mix.
Yes. So cabbage juice is one of the richest food sources of glutamine, which is an amino acid that in research has been shown to reverse increased intestinal permeability, help with the microbiome. And my approach is in general, always use food when possible. So if a person is open to it and interested, then juicing cabbage is a very good way to get that glutamine, which is the most important active ingredient. And if a person prefers not to go through the trouble of doing that and would rather take a supplement, that example is okay because glutamine is widely available. It's an amino acid that is sold in supplement form as well. But cabbage juice is one of the best food sources of it.
Another unique piece of the diet that sticks out as I read your book is the broccoli sprouts. And these have gained a lot of momentum in the health world in general, but talk about when it comes to autoimmune disease, why you've included these.
Yes. So broccoli sprouts are the richest food source of sulforaphane, which is a compound that over 2,000 research studies have shown reduces inflammation, supports brain health, it counters oxidative stress, supports the microbiome, supports your neurotransmitters. So many multiple different benefits. And cruciferous vegetables are a reasonably okay source, like broccoli, cauliflower, Brussels sprouts. They do have some sulforaphane. So, but the interesting thing is with broccoli sprouts, they can have up to 100 times the sulforaphane as regular broccoli, for example. So, really, the richest food source of this very powerful antioxidant and anti inflammatory compound. And then I'll just mention one tip for how to boost sulforaphane. So, in your cruciferous vegetables, there was a study that adding a source of this enzyme, myrosinase enzyme, which is found in a brown mustard seed powder. So, in this study, they added a bit of that to cooked broccoli, and the absorption of the sulforaphane was boosted by 400%, by fourfold. So, that's a good way. If you're not able to eat broccoli sprouts, you can have broccoli, but add that mustard seed powder to get a lot more of the sulforaphane absorbed.
I wonder what would happen if you made a sprout salad with broccoli sprouts and put some of that brown mustard seed powder in the mix.
Oh yeah. Well, the good thing about broccoli sprouts is they are rich in the myrosinase enzyme, so they have it kind of built in. But the other foods that are cruciferous vegetables do not. So that's where you get more of a benefit.
Okay, so we have broccoli sprouts. For somebody that is facing an autoimmune condition right now and they feel overwhelmed, and that sounds like a big thing for them to take on, like the cabbage juice, you mentioned the fact that we can take a supplement for glutamine. Is there a sulforaphane supplement that can take the place of the broccoli sprouts, at least for phases, if people are feeling overwhelmed with everything and say they're all new to this and they just aren't going to do the broccoli sprouts in the beginning?
Yes, absolutely. So sulforaphane supplements are widely available. There's many brands. One that I often recommend to my patients is called Broc Elite, like BROC Elite. I have no commercial affiliation with them, but I just find that to be a good product, standardized to sulforaphane content. So I think a high quality sulforaphane supplement is certainly an option because for whatever reason, many people are not able to incorporate the broccoli sprouts.
We're going to get to gut health as one of the drivers eventually here. But while we're on the food piece, how do you look at fermented foods as a piece of this diet as a whole?
A very big piece. So I think two categories of foods that I strongly emphasize in both the phase 1 and the phase 2 diet are the fermented foods and prebiotic foods, which we can come back to. Prebiotic foods have fibers that uniquely feed your good bacteria. But with fermented foods, there was a study from Stanford showing that 6 weeks of increasing fermented food consumption in adults reduced 19 different markers of immune system dysregulation and inflammation in the body. Plus, it boosted the diversity of the microbiome, which again is one of those key metrics for longevity. So, pretty remarkable change in just 6 weeks with introduction of fermented foods, and that's why that's a big part of the diet. Even when you're doing the elimination diet, you can have non-dairy fermented foods like your sauerkraut, kimchi, coconut kefir, kombucha, all those things. You don't have to have dairy. And then potentially in the phase 2 diet, you can reintroduce some dairy containing fermented foods. Make sure you tolerate them, of course.
Okay, and when it comes to the fermented foods, before we move into the prebiotic ones, how do we know we're getting enough? Is there a certain amount you recommend per day, per meal? How do people go about navigating that?
Yeah, so with fermented foods, it does not need to be a high dose. So what I recommend, for example, if a person is willing to have sauerkraut or kimchi, just a tablespoon with your two biggest meals of the day is sufficient because it's something that is effective even in low doses. Another example is with kefir. So this is a fermented either dairy or non-dairy beverage, and excellent source of probiotics and good bacteria, but sometimes patients have to start very small. So they might only be able to have like a teaspoon of kefir in the beginning. And then over some months, they might be able to gradually work up to like a full cup. But starting low is often necessary to make sure that people are tolerating them. And then over time, as the gut is shifting, it will be able to handle more and more. But with fermented foods, yeah, small quantity, but consistency is the key. Having it like every day or most days of the week, small doses is effective.
And tying back to the cabbage juice, classic sauerkraut is made from cabbage. And when you get to the bottom of the jar, you have that juice there. And obviously that's full of good bacteria. Plus it wouldn't be pure juice, or maybe it would be. I'm trying to think of if there's any water added to making sauerkraut. I think it is actually pure cabbage juice. So I could see how that would be an effective way to get both pieces together.
Yes, absolutely. And with sauerkraut, for my most sensitive patients, I've had them start with just the sauerkraut juice, where they can tolerate maybe a teaspoon of sauerkraut juice and then build up to a couple of tablespoons. And then they can start to tolerate a few strands of sauerkraut and gradually increase that. But sauerkraut juice, yeah, very rich in glutamine and beneficial bacteria.
So you talked about the importance of getting these fermented foods in on a regular basis. In your research, what does science show when it comes to repopulating the gut using fermented foods? Is it more so, the way I understand it is that we're constantly adding to the bacteria, but they don't really stick around much. What have you found in that realm?
Yeah, you're exactly right. So, especially with probiotic supplements like capsules of probiotics, they generally don't colonize or establish like a foothold in the microbiome. They, after 2 weeks of stopping taking a probiotic supplement, usually those bacteria are gone from the system. But it doesn't mean that probiotics are ineffective because they're more like immune modulators. They talk to your other bacteria, and then while you're taking them, they can have profound benefits. So when it comes to the food component, it seems like long-term strategy with prebiotic foods is effective at boosting the diversity of the microbiome. The fibers in your diet, especially plant fibers, those are really key drivers of that diversity as well. And fermented foods have been shown to boost the diversity of the microbiome. So I think having a diet with plenty of prebiotic foods, diverse plant fibers, and fermented foods is the best way long term to boost the microbiome diversity.
You touched on probiotics there in supplement form. For somebody that wants to put that into the mix, is that a good thing if they're already taking in, a good amount of fermented foods? Do you find that's necessary? And then if so, what type do you recommend? Because there are so many different types on the market now. Ones that need to be kept in the fridge, ones that don't, spore-based, soil-based. There's so many, it's becoming very complex. So how do you feel about probiotics and including them into your diet mix here?
Yeah, I use probiotics a lot. They're a big part of our practice, but I think you really need to work with a practitioner on that because what I have also seen is sometimes patients take certain probiotics on their own and then their symptoms get worse. Their autoimmune disease gets worse. That was not the right fit for their unique situation. So, generally speaking, though, I think that in my book, I mention a few categories of probiotics. So, Lactobacillus rhamnosus GG, which is commonly sold as Culturelle, is the brand, and also present in other brands. That's a species. So, with probiotics, we always want to look at the strain. So, there's the species, and then there's also this individual strain of bacteria. It's very important to take a probiotic probiotic that lists this strain, because then the company realizes the importance of that. The same species, different strains can have very different properties. So you want to make sure that's on the label. Culturelle or Lactobacillus GG has been researched for more than 100 years. It's been around for a long time, a lot of good data to support the use of it. I think another probiotic that we often use a lot is Saccharomyces boulardii, and the CNCM 745 strain. So with Saccharomyces boulardii, it's a beneficial yeast. And like in our body with good bacteria, we have good yeast as well. And Saccharomyces is one of the key ones. So the good thing about it is then it does not get affected by antibiotics. So just like antibiotics kill bacteria, they do not kill the beneficial yeast. And so Florastore is a common brand, or other products that contain Saccharomyces boulardii. Also, nearly 100 years of research behind that probiotic strain. So those are a couple of good options, but there are many more.
Well, let's move deep into the prebiotic piece. So we're going to get fiber if we're including plants in the diet. It's going to help feed the bacteria in our gut. But when it comes to different types of prebiotic and how much, how often, let's get into the details there.
Yes. So I think, prebiotic foods is a very important topic to discuss. And I like to break it down into the categories of prebiotics, and then we can talk about foods that are examples of each. So in my book, I've given hundreds of examples of these foods, because I think the key thing is you don't have to eat all of them. You just have to find some that you like, that you tolerate, that you can have regularly. So the big categories of prebiotics are polyphenols, which are plant flavonoids that feed your good bacteria. And some of those are surprising. So, for example, among nuts and seeds, ground flaxseed is excellent, but chestnuts are the second richest food source of polyphenols, which we often think of as just a holiday food, but very good for the microbiome. When it comes to vegetables, capers and olives are among the highest in polyphenols. So, of course, your leafy green vegetables are great, cruciferous vegetables are great, but that's what I mean in terms of sometimes it's surprising what is highest in the polyphenol content. Other categories of prebiotics are resistant starch. So with that, there's type 1, type 2, and type 3 resistant starch, which we can come back to. There's inulin, which is an excellent prebiotic that is found in many different foods like artichokes, asparagus, onions, and garlic, if you tolerate them. Then there is GOS, galacto-oligosaccharides, which are often found in legumes and beans, which are excellent if you tolerate them. And then there are arabinogalactans, which are in your radish, pear, coconut, other foods like that. So I think at a high level, knowing about these different prebiotics is a good start to then go into the individual foods within each category.
For somebody right now that's feeling overwhelmed hearing about all the different categories, how important is it that we get different foods from each category?
Yes, the thing with prebiotic foods is each of them feeds multiple different species. So I think if you're able to at least include foods from 2 or 3 prebiotic categories, that should be sufficient. What I tell people is to aim in a week for at least 40 different plant foods, because ultimately that's what drives the diversity, diversity of the diet. So we know with our Paleolithic ancestors, often they would eat 100 different varieties of plant foods in a month. And now the average person, I think, eats less than 10 different varieties in a whole year. So obviously we can't go back to eating 100 different plant foods, but aiming for 40 in a week. And one tip to achieve that number is that different colored fruit foods count separately. So green apple counts separate from a red apple, separate from a golden delicious apple. Spices are a great way to get those prebiotics. So if you use turmeric, ginger, garlic, cinnamon, and fenugreek in a week, that's 5 plant foods right there. So using tips like that, you can get towards that goal of 40 different plant foods. But it doesn't need to be from every single category. If you at least pick like 2 or 3 categories of prebiotics, that would be adequate.
So it sounds like the easiest way not to get overwhelmed is just aim for that diversity, and you're naturally going to cover foods from different categories.
Exactly.
Let's come back to the resistant starch. When you got to that part, you said there's 3 different types. Let's break those down.
Yeah. So type 1 resistant starch is found in certain grains and legumes, especially whole grains and whole legumes. So oats and oatmeal are a good source. Beans of all types and lentils are great as well. They have that resistant starch in their skin. And other gluten-free grains, sorghum, buckwheat, those are good sources for type 1 resistant starch. Type 2 resistant starch is found in certain foods like green banana, green plantain. There's also potato starch. So these are a little bit harder to find, but if you can usually find plantains in your grocery store, that's an excellent source. If you get bananas when they're a bit more green, then that also contains significant amount of type 2 resistant starch. And the potato starch is type 2, and that's more of a supplement, which you want to work under a practitioner's guidance, but that's another good way to get type 2 resistant starch. And then finally, type 3 resistant starch is retrograde starch, which is formed when certain foods are cooked and then cooled. So with potatoes, like regular white potatoes, that's actually a good source of type 3 resistant starch, like a potato salad, where you would cook it and then freeze or cool it overnight. And then it's pretty heat stable, so it can be heated back to room temperature without damaging the resistant starch. And also, you can get the same type 3 resistant starch from white rice or brown rice, cooked and cooled, and with a bit of coconut oil. That is a way to increase the resistant starch content that way.
When you were talking about type 2, you mentioned the fact that you could take a supplement, and that's where I wanted to go next. But you mentioned the fact that if we're going to do that, we want to work with a practitioner. So what you're saying is don't just go to the health food store, grab a prebiotic fiber, and add that to the mix without working with somebody?
Exactly. Yeah. Because, for example, if a person has SIBO or small intestinal bacterial overgrowth, that might be worsened by certain prebiotic fibers. In those cases, you can still use like selective prebiotic fibers, but that's where if you just go to the store and, pick a random one and start with a high dose, there's a high likelihood of like worsening symptoms or causing some type of gut reaction.
When we were talking about food from the toxin perspective, you mentioned GMOs. So obviously we go organic. We're going to avoid those. We're going to avoid pesticides. Have you come across any of the research talking about nutritional profile of food, organic versus conventional?
Yes. In fact, studies show that it's probably true that that organic produce contains slightly higher levels of vitamins and minerals than conventional counterparts, probably because of the farming techniques that are used. The soil is of higher quality. So you're not only getting the lower toxin and pesticide residues, but you are getting more nutrients. And that's very important because globally, soils are very depleted. So that's why the Department of Agriculture has found that an apple today compared to an apple from 100 years ago is much lower in nutrients, and that's true for a lot of different foods. But choosing organic is a way to also maximize the nutrients in those foods.
And while we're in the food category, when it comes to autoimmunity, are there any specific foods that are good for helping fight against that or prevent it? Things that we want to make sure we're including in the diet.
So I think the fermented foods are definitely high on the list because we know from research that they reduce inflammation and also boost the diversity of the microbiome. So that's an essential category. And then prebiotic foods. So just the diversity of those different types of prebiotics, whatever you can tolerate, that will comprise plant food diversity in your diet. So you aim for those 30 to 40 different types of plants in a week. So I think that those strategies long term will be highly successful.
Got it. What I was getting at more was the specific superfoods, like certain things like goji berries or certain foods that are above and beyond that we want to make sure are included in the diet.
Yes, there are a few that I like in that category. One is beet greens, which are the leafy tops of beetroot. They're the richest food source of betaine, which is a compound that helps methylation, a process that occurs like a billion times each second throughout your body. And also, they support your glutathione levels. So it's a way to boost your antioxidant and glutathione levels, which are important for your detoxification pathways. So, yeah, we always try to get beets with the greens still attached. And then you can cook them just like you would any leafy green like kale or spinach, and you don't lose any of the benefits. That I consider a true superfood. I think second, I would mention chlorella, which is a type of algae that often is sold in a powder form. I like to add it to my smoothies. Chlorella has some interesting research showing that it may help with excretion of toxins, especially mercury and heavy metals like that. Plus, extremely rich in phytochemicals and beneficial plant compounds. And then the third category of which I'll speak about for superfoods is spices, because I think those are so underutilized and they have multiple benefits for people. Reduce inflammation, they prebiotics, so they boost the microbiome, they help your blood sugar regulation, they're excellent antioxidants, so they counteract the oxidative stress. So I think getting variety of spices, I talk about a bunch of them in both of my books, but 'cause I like to really teach people how to use spices. But getting your turmeric, ginger, cinnamon, garlic, those are more well known. And then also if you can incorporate cinnamon, fenugreek, ajwain, black cumin, some of those lesser known spices, you get a lot of bang for your buck with those spices because you're really benefiting multiple pathways and organ systems.
As you talk about beet greens, turmeric, it gets me thinking about oxalates and different plant toxins as a whole. How do you look at those when it comes to autoimmunity? Is this something we need to be wary of and moderating how many we're taking in? Or is that not important when we're going through a protocol like this?
For certain people, it is important, especially if you have a history of kidney stones, which are often oxalate derived. And then in that case, yeah, you have to be very careful with not overdoing it in terms of oxalates in the diet. There are other limited population, but some people who do have oxalate sensitivity and get reactions from over consuming oxalates, and that's what you'll figure out when you go through like the phase 1 diet and then reintroductions and see what you tolerate. I know there are some there out there who believe that all oxalate containing foods are toxins for all people. And I just don't really think that's true. In terms of the research, many of these foods are, if you tolerate them, and if you don't have a history of kidney stones, are associated with longevity and reduced inflammation and are likely health promoting foods. So for the majority of people, I think they can consume oxalate rich vegetables and foods as part of a balanced diet.
So, by the sounds of it, there's different tiers when it comes to elimination diets, when it comes to autoimmunity. Your phase 1 diet, a little bit more intense, would be the AIP diet. And while we're talking about plant toxins, it brings up the carnivore diet, the ultimate elimination diet. So, there is a lot of talk in the carnivore world about that being helpful when it comes to autoimmunity and using that diet as a treatment. Why not go all the way there, eliminate as much as possible, and then work our way back? How do you feel about that?
Yes, I think for certain people, it can be a game changer. That's what I've seen with some patients that whereas nothing has helped bring down their inflammation or symptoms, going on a carnivore diet really did and was transformative. But then what I've seen is that if they stay on it too long, they start getting negative reactions, and I think the reason for that is that like any elimination diet, the carnivore diet should be more short term. Whether you're doing AIP or the phase one diet or carnivore diet, I recommend limiting it to 2 or maximum 3 months because you're naturally in any elimination diet is very limited. And so you're going to be not feeding as much of the good bacteria. So your microbiome diversity will drop. And in the short term, that's not harmful. But in the long term, if you stick with a very rigid elimination diet, like the carnivore diet, for example, there's a complete absence of all of those prebiotics because they're not found in animal foods. You're not getting any prebiotic foods or fermented foods or plant fibers. And so your microbiome is going to suffer in the long term, which is important for long-term longevity. We have to balance out short-term relief of symptoms, which is important and can be achieved with the carnivore diet. And then after that, you want to have a systematic reintroduction of foods. Try to get the most diversity back in your diet without exacerbating your symptoms, because in the long run, that will support your microbiome better.
So when it comes to these different elimination diets, whether it be your phase one diet, AIP diet, carnivore diet, I think it would be helpful for people to understand and get into the details of what introducing foods back in looks like. So can you take us through the details of what that process is?
Oh, for sure. Yeah, I think this is an area where people benefit from a lot of guidance because it's hard to do this on your own. A few concepts that I think are valuable. So, one is keeping track with like a food log, food journal. You can use, just in your phone, make notes is very important because over those 6 to 8 weeks of reintroducing, you're going to be reintroducing a lot of foods, and it'll be hard to remember unless you're recording all of these things systematically. Second point is not to introduce multiple new foods at one time. And I recommend no more than 2 new foods per week because some of these food sensitivity reactions can be delayed by 2 or 3 days. We know based on the antibody that's involved, if it's an IgA or IgG antibody, there might be a delayed food sensitivity reaction. And so that's why if you, for example, on Monday reintroduce almonds, then you don't need to eat that on Tuesday and Wednesday, but you want to monitor for any type of symptoms. So there could be a wide variety of reactions, sometimes GI symptoms, constipation, diarrhea, gas or bloating, or constitutional symptoms, fatigue, malaise, brain fog, joint pains, skin issues. Basically, you want to look for any worsening or any new symptom. And then if you don't have any of those that show up, then you can add that food to the okay list. And then, so Monday you reintroduce almonds, then Thursday you can reintroduce another category. So maybe black beans, for example. So I like to also recommend that people reserve dairy and gluten for the very end because those are statistically the most likely to be food sensitivities. Gluten, probably the biggest one, which I would suggest to reserve for the end. Dairy, before that. And then in my book, I also talk about the different gradations within dairy because, it's quite different when you go from milk to heavy cream to yogurt to ghee or clarified butter. The levels of casein and lactose vary quite substantially, and that's what leads people to tolerate certain dairy products and not others. So with dairy products, you also want to be pretty granular with how you reintroduce them.
And for somebody that has had an autoimmune condition and they work through your protocol, bring it into remission, how often do you find people in that category can introduce things like dairy and gluten and keep their disease in remission?
Yes, so it depends on the person. With dairy, I've definitely seen more successful reintroductions than with gluten. I think gluten is probably more inflammatory. And with dairy, I often see that it's a subtype. So, for example, a person might be able to tolerate butter, cream, and certain yogurts. But if they're having like milk or ice cream or other dairy, they're getting reactions. So, I've seen more success with dairy than with gluten. And I think that, gluten in general is more inflammatory because of how it's been genetically modified and evolved over the past 100 years. There's much more gluten in our modern wheat than wheat that our grandparents might have eaten, 100 years ago. Plus, there's new chromosomes and other results of genetic hybridization that make wheat a bit harder to process. And so, for that reason, I think gluten is often inflammatory.
So we went deep into the prebiotic piece, probiotics, and fermented foods in that middle part. Let's move now into the latter part, which is postbiotics. And this gets into how these bacteria, when we give them the right medium, the right foods, and we grow that diversity within our system, how they benefit us.
Yes, absolutely. Yeah. So some of the most important postbiotics, which are metabolites that are produced by your probiotic bacteria, are short chain fatty acids. So these are compounds that are supposed to be made by your good bacteria. They include butyrate, acetate, these type of lactate, these type of organic acids. And they have significant anti-inflammatory effects in the gut. They also help your gut-brain axis. They can even help heal leaky brain. Just like you have leaky gut, if you have an impaired blood-brain barrier, you can have leaky brain. But the short-chain fatty acids, especially butyrate, have been shown to help with healing both of those. And with these metabolites like postbiotics, there's two options. You can either take a supplement, which has these short chain fatty acids and other metabolites, but my preference is to really try to get your own bacteria to produce them, which is what they're supposed to do. And, that will have other benefits too, like boosting the diversity of the microbiome, all those butyrate producers. And actually, a good metric for short chain fatty acids is stool pH. So this is a test that can be done through any laboratory. It's a pretty old test. But we know from the research that optimal stool pH is acidic, meaning less than 7, around 6.5 or so. And stool pH is mostly driven by short chain fatty acids, these postbiotics. So that's a good metric to track. And often I find that when people are able to boost their, prebiotic foods and their plant food diversity, then their stool pH improves because they're producing a lot more of those postbiotics that are key.
And how quickly could you see that change with the stool pH if somebody started to make some of the changes to help their microbiome?
So there was a study which found that after just 2 weeks of increasing fiber intake, there was a significant drop in stool pH. In that study, participants went from consuming about 17 grams of fiber per day to 34 grams. So they're still not, consuming like 100 grams or 50 grams. It's just getting to that in the 30s, 34 grams. But just in 2 weeks, that was able to bring down the stool pH. So the great thing about the microbiome and the immune system is that it can respond quickly in some cases, and these changes have measurable beneficial effects.
So within the toxin category, things we ingest, you talked about cosmetics, and that can be taken in through the skin. We talked about food. The other big piece here is hydration and water.
Yes.
So for somebody that at this point isn't filtering their water, why is this a good idea?
Yes. So water is often a hidden source of toxins. There was a study by the Associated Press which investigated water in municipal drinking water around the country and found often there are pharmaceuticals there, like antibiotics, oral contraceptives, even psychiatric medications. And the reason for that is that unused medicines get flushed down the toilet a lot, and our water processing plants are not set up to filter those out. So good options for filtering your water are either a reverse osmosis system, which is more of a permanent installation in the house, or there are countertop uh, filters like the Berkey, the Zero, Zero, which is similar in price to a Brita, but third-party testing has found it to be a bit more effective for removing toxins. So if you're not able to get a reverse osmosis system, I think one of those countertop options is good as well. But it's not only pharmaceuticals, there's also other toxins like PFAs, which are some of these industrial chemicals. There are pesticides, which the Department of Agriculture found about 50 million Americans have drinking water that could be contaminated with pesticides. Low levels of heavy metals. I know that was an issue in Flint, Michigan, but in other parts of the country, other industrial compounds like TCE, perchlorate, these have been found in the drinking water. So a lot of reasons to just get a good filter. And then I recommend avoiding bottled water because often it's in plastic and then you're getting the microplastics through that exposure.
One of the arguments you often hear when it comes to, say, RO water is the fact that those systems do remove a lot of the contaminants in the water, but you're also removing the minerals. How much of a concern is that for you? And are you somebody that likes to add minerals back into the water, or do you not worry about that?
Yeah, I think that is also kind of overemphasized because with minerals in water, it's mostly in developing countries that they are a significant source of dietary intake. So in the West and most modern societies, because we get so many more minerals through our foods, our fruits and vegetables, the amount you might get of, say, magnesium, zinc, these trace minerals from the drinking water is not significant compared to, how much more you're getting through the diet. So it's also not true that, reverse osmosis will cause your body to dump minerals. Nothing like that occurs. There's nothing wrong with adding back minerals. We don't do that, but you can if you want. I mean, certainly it might improve the taste if that matters to you. But I don't think medically it's necessary to add back minerals when water is using RO, purification.
And the other two areas that come to mind when we talk about water is acid alkaline balance and structuring of water. Are those things that you are concerned with at all, or is that beyond what we need to worry about?
Yeah, I think those are interesting concepts. I don't think we have enough research yet to really say that it's a valid and reliable way of improving water quality. I don't think the acid alkaline factor is very significant because that doesn't really shift the pH within our body. The blood pH is very tightly regulated within a very small range because if you go out of that, you would die because blood pH is very tightly regulated. The one pH which can fluctuate is intestinal pH, which we can measure through the stool pH, but that does not really get changed much from the drinking water. It responds mostly to the plant fibers, the prebiotic foods, which lead to the short chain fatty acids, which optimize the stool and colon pH. So I don't think the water has a big role to play there.
And what about carbonated water? There's certain brands that bottle it in glass, like San Pellegrino and Mountain Valley. There's also SodaStream, where you can take, say, your RO water and add carbonation to it. Is that something that's okay, or how do you feel about that?
Yes, I think that's pretty neutral. I don't think there's really significant negative effects. And if you're going to have that instead of a soda or diet soda, then it's a much better alternative because you're, just having fewer ingredients and making it at home. So I don't see any issue with carbonated water. I think that's pretty neutral.
And every time filtered water comes up, I tend to think about and bring up shower filters. This is an area I think a lot of people who have taken that step and started to filter their drinking water don't necessarily go all the way and factor in that other input. So how do you feel about those?
I think that's an important topic, and often in the showers, because of the heat, certain toxins can become aerosols and then be either inhaled or absorbed through the skin. So we shouldn't ignore showers. And there are multiple good brands like Aquasana or Berkey that provide shower filters. Usually it's pretty easy to install it on your own. They're not extremely expensive. And then, they often last for a year or so before they need to be replaced. So I do think that is important.
While we're on the beverage topic, let's talk about alcohol. I'm assuming this isn't something, if we're trying to treat an autoimmune condition, we want to include, but talk about that. Are there any exceptions?
Yeah, I think, as part of the phase one elimination diet, I do recommend eliminating alcohol. And then, if you want, you can try reintroducing it in the phase two. But certainly, you want to reintroduce all the foods first to make sure you figure out what you tolerate, because that's the most important in terms of long term diversity. And then with alcohol, I think we have to remember that certain types of alcohol that are thought to be beneficial, like red wine, for example, it's really not the alcohol at all. It's the grapes. And so you can get the same benefits from, eating grapes or drinking grape juice. It's not something about the alcohol that's beneficial. So while alcohol is not really beneficial for health, we have to realize there's a social component. Because the mind-body component is so important, cultural factors, social and communal factors are very important. So those cases, I think there's a argument that including a bit of alcohol moderately, if you tolerate it, can be fine and have all those other benefits that are not physical. So I think that it's definitely good to eliminate and then reintroduce, observe what you tolerate, and then on social occasions, reserving it for those times.
One of the other things you address in the book, and it fits nicely into this realm while we're talking about drinks, is caffeine through things like coffee and tea. So for somebody, again, trying to fight off an autoimmune condition, do they need to cut those out, or how do you feel about that?
Yeah, so I recommend, doing an elimination in the phase one diet where you're eliminating all caffeine. And sometimes people are surprised that they actually are, sleeping better. They're not as anxious. They may not have realized that they were as sensitive to caffeine as they are. But then many people do tolerate it. And when you go through the reintroductions, you can bring back coffee, green tea, black tea, all three of which are very high in polyphenols. As far as prebiotics go, coffee, black tea, and green tea are excellent for their prebiotics, their phytochemicals. They're I think they're health promoting foods, they're associated with multiple health benefits. I especially like green tea because it's very good source of antioxidants. I like the matcha green tea, which is like the richest green tea in antioxidant content. And one great thing about green tea is it's a prebiotic for your oral microbiome and your gut microbiome. So just like you've got all those 40 trillion bacteria in the gut, you have about 7 trillion bacteria in the mouth, which are very important. And research now indicates they are key regulators for inflammation and also autoimmunity. So making sure your oral health and your oral microbiome is important, is in a good place. So with green tea, what you do is just swish it around your mouth for a few seconds before swallowing. And that way you get those oral microbiome and then the gut microbiome benefits when you swallow.
Let's stick on that oral microbiome piece. I'm glad we went there. So we know green tea can be beneficial. Let's start by talking about some of the things we might be doing now, like mouthwash or using certain toothpaste, that could be destroying that.
Yes. So I think most commercial mouthwashes, are very harmful, for the oral microbiome. I think with toothpaste as well, you want to make sure you get a pretty clean product. I especially like toothpaste with xylitol. So xylitol is a sugar alcohol extracted from birch trees that has been shown to help with the biofilm, which is a uh, key concept. So, biofilm is how bacteria congregate, and that's how they reside, in the oral microbiome and throughout the body. And xylitol improves the biofilm. It shifts it from potentially pathogenic to more beneficial. So I think incorporating toothpaste with xylitol, there's many out there now, is excellent strategy. Another thing that often worsens the microbiome is mouth breathing. So people often don't realize at night, especially, their mouth breathing. And then because saliva is such a key factor for oral health, when you are mouth breathing, you get the dry mouth and the loss of saliva, which allows bacterial overgrowth. So the simple strategy of mouth taping, which a lot of my patients have done, can help resolve that while you're sleeping, to prevent mouth breathing. And then finally, cavities and infections can be present. Root canals are often problematic. So, not in all cases, but for some, root canals can be a hidden source of infection, which can drive inflammation. So, you'll want to pay attention to all those different factors.
And for somebody who is scheduled to have a root canal done and they're weary about having that procedure, what safer alternatives, or are there any, they can look to?
Yes. So with root canals, you have the option for working with a biological endodontist. So an endodontist is a specialist in root canals, and you want to really consult someone like that because they have special technology, like an X-ray known as the cone beam X-ray, is a much better way to assess the root canals than conventional X-rays. And then there are techniques using, for example, ultrasound or ozone therapy, to help address these infections. So a lot of different strategies that can be used there.
How do you feel about cavitations from previous wisdom teeth surgery? This is something that comes up from time to time in the health world, and it's not brought up enough, I would say. Is this something you're informed on?
Yes, I agree. I think cavitations are a key factor, and I think that it's important to look into that. So that can be a hidden source of inflammation, hidden source of infection, and I think important not to be overlooked.
While we're on the oral health category, one of the things I've been doing for years, and I really like it, is to use a tongue scraper first thing in the morning.
Yes.
You do. I believe you talk about those in your book. Talk about your feelings behind it.
Yes. So I think a tongue scraper is an excellent strategy in terms of getting the bacterial count on the tongue reduced. Significantly is reduced with tongue scraping. And then another strategy from Ayurveda that is very powerful is oil pulling, where you include coconut oil and are able to, just swish it around your mouth for a few minutes. That is excellent antimicrobial and really good for the oral microbiome as well.
So we've gone deep into the food. We've talked about drinking clean water. Tying into both of those is intermittent fasting. And this is a subject that's come up many a times on the show. I'm a big fan of it. How does that fit into your protocol?
Yes, so I think intermittent fasting is very powerful, and there are studies showing benefit in multiple autoimmune conditions like psoriasis, multiple sclerosis, and rheumatoid arthritis. Those three specifically, they have shown benefit with the intermittent fasting. And I think there's not only metabolic benefits like weight loss and blood sugar improvement, but also an anti-inflammatory effect. So I think you're getting multiple benefits if you can incorporate intermittent fasting. And it doesn't have to be every day, but at least a few times a week. If you can eat within a, for example, 8-hour window and have 16 hours of fasting, that's highly beneficial. And you can build up to that. Start with, 12 and 12, and then 10 and 14, and then build up to the 8 and 16.
Up until this point, in the realm of toxins, we've primarily talked about them from prevention, cleaning up our world to prevent. When we were talking about superfoods in chlorella, you did mention the fact that it can help with removing toxins. I want to open that up and go into that deeper now. So for somebody who is tuning in and they're going to make the changes we've talked about to prevent for the future, that's great. But what do they do about all the toxins they've accumulated in their body throughout their lifetime to this point?
Yes. So I think that, there's a lot that can be done to help reverse toxins and clear them from the body. We know that raising glutathione levels is one of the great ways to do that because the liver has its own intrinsic detox pathways, and boosting glutathione, improving your methylation are some strategies to help with detox. And then I think sweating is really underutilized. So research has shown that sweating in a sauna is a very effective way of reducing multiple, kinds of toxins that have been associated with autoimmunity, like heavy metals, endocrine disrupting chemicals, pesticides, all of which have been measured in urine, not urine, in sweat from people who are in a sauna. And there was actually a study comparing sweating in a sauna to sweating from exercise. And that showed that actually sweating in a sauna was more effective at removing toxins.
And for somebody that wants to adopt a sauna protocol in their autoimmunity protocol, how often do you recommend and for how long?
So I think starting with 20 minutes a day, maybe 2 or 3 times a week. So aiming for that 40 to 60 minute time in a week is a good way to start. And then there's no ceiling in terms of where the benefits stop. So if you can do it every day or 4 or 5 days a week, that's even better. But minimum, I recommend twice a week. So 2 to 3 times a week is a good minimum.
Let's move into the I part of the Tiger protocol, infections. Somebody tuning in right now might be saying, I feel good. I don't have anything going on. What are you talking about when you're referring to infections?
Yes. So when it comes to infections, there's different categories. There are bacteria, viruses, fungi, parasites, mycobacteria, archaea. So a lot of different categories, and many of these might be asymptomatic. So that's where it's important because a person typically thinks of an infection as something, with fevers, chills, very obvious acute infection, which is true for, acute infections, but we're talking more about chronic infections. These can be low-grade imbalances, for example, fungal overgrowth or overgrowth of potentially pathogenic bacteria, which may not cause significant symptoms, but they may be contributing to inflammation. So I think for that reason, it's important to address them.
Okay, so for somebody who's thinking to themselves, again, I'm not feeling anything right now, the logical question would be, do I have to test for these? How do I know if they're impacting me?
Yes. So I think if you do have an autoimmune disease, it's a good idea to be tested for infections. You can work with a practitioner who can do blood testing, stool testing, whatever testing is needed to identify infections and then address them using ideally more holistic approaches and not pharmaceuticals. And there is one thing you can do to really reduce your risk of any of these opportunistic infections, and that's to optimize your intestinal pH. Because the research shows that below 6.5, a lot of these pathogenic bacteria like Bacteroides or Klebsiella really do not overgrow. And your pathogenic yeast, like Candida, only overgrows at high pH above 7.5. So by optimizing your pH, getting those short chain fatty acids, those postbiotics is the way to do that. You're reducing your risk of all infections.
Okay. So other than coming back to what we've gotten deep into, taking care of the gut microbiome, anything else impact the pH of the GI tract?
So the biggest driver is really diet. The gut bacteria produce short chain fatty acids, which optimize the pH. But then, if you intake fermented foods that have some of those beneficial organic acids, for example, sauerkraut has both lactic acid and acetic acid, which are produced by your bacteria. But if you take in sauerkraut and sauerkraut juice, you're getting those beneficial organic acids. Same with vinegar. So vinegar is by definition acetic acid, and acetate or acetic acid is produced by your gut bacteria. So incorporating foods that have vinegar, any type of vinegar in salad dressing or in fermented foods, also helps with the intestinal pH.
And I believe when we talked about acid alkaline water, you mentioned the fact that that can't change the pH of the body, but it can affect the GI tract too.
Minimally, yeah. I think even with the GI tract, it seems to be much more driven by foods than water, and the gut microbiome. So for those reasons, yeah, I don't believe there's a lot of benefit. I mean, alkaline water often has electrolytes added, which is great, especially if you're working out. But in terms of the pH balance in the body, I think the effect is minimal.
As you talk about electrolytes, it gets me thinking about salt, which is a controversial topic within the health realm. When it comes to autoimmunity, is salt something we want to be adding to our food, being wary of? How do you feel about salt and different types? There's obviously your regular salt that's been iodized, and then there's sea salts.
Yes. Yeah. So I think with salt, there's a kind of U-shaped curve with morbidity and disease, where if you have too little salt or too much salt, that they can both be harmful. So somewhere in between, in that 2 gram per day range is where that I think the sweet spot lies for salt. So if you have high blood pressure or issues like that, like fluid retention, congestive heart failure, kidney disease, there's multiple reasons why you might need to be lower in your salt intake. But for an average person, I think having a moderate salt intake, typically I do recommend iodized salt, because iodine deficiency is actually pretty common in, even in the West. Iodine is found in like shellfish and fish, but we often don't eat enough of that. So iodized salt can be a good way to supply that essential mineral. And I think 2 grams is kind of the sweet spot.
And when it comes to salt in the health and wellness space, a lot of people like to recommend sea salt. You're mentioning iodized salt. Is that the two of them together, or is that just regular salt that's been iodized?
Yeah, you can find sea salt that has been iodized. I think that is an option. Alternatively, I think regular salt, as long as it doesn't have a lot of these additives and fillers, like if it's just pure salt, even if it's not sea salt, it's better without those additives, and then often has iodine added.
Okay, before we leave the infection piece, just to summarize what we've gone over. Somebody with autoimmunity might have a latent infection. There's testing that can be done. And hopefully, if somebody has something come up, they can, within the natural realm, kill that off and eliminate that burden from their system.
Yes.
Before we close the door on that, anything else we want to know within that category?
One other thing within infections that I think is very interesting is the role of mycobacteria. So mycobacteria are different from bacteria. They have much thicker cell walls. They're more resistant to drugs. Most famous one is TB, so tuberculosis. That's less of an issue in the modern developed world, but another type of mycobacteria called Mycobacterium avium complex, or MAC, has been significantly associated with autoimmunity, especially in type 1 diabetes. It seems to be one of the key triggers. And also with multiple sclerosis, it's being studied, and inflammatory bowel disease. So mycobacteria have been hard to stain and characterize, identify. So a lot of the newer staining methods within the past few years has identified, there's a really big discrepancy. For example, with Crohn's disease, which is autoimmune disease, they looked at 21 patients, and all 21 patients with Crohn's disease had evidence of this mycobacteria, whereas 0 out of 20 healthy controls had evidence of it. So I think that the other thing with mycobacteria, the MAC complex, is it can sometimes be in dairy products, especially milk. Sometimes because this MAC bacteria is so hardy, it can even survive pasteurization. So it might make it in low levels into milk or dairy products. And some scientists think this is why there's a correlation between dairy intake in early childhood and type 1 diabetes in certain studies.
Couple of other areas I want to touch on before we leave infections. One being Epstein Barr. And this can get a little bit complicated because in your book you talk about, I think it's 95% of us have been impacted and infected. Where does this become a problem?
Yes, with Epstein Barr, it is ubiquitous. Most of us are infected. I think that the issue is that many of us with autoimmune disease have trouble keeping Epstein Barr in check because it never leaves the body, but it's not supposed to be active and chronic. But research shows that patients with autoimmune disease like rheumatoid arthritis, multiple sclerosis, they tend to have higher titers or blood levels of Epstein Barr virus, and they seem to have a harder time keeping it under control and from reactivating, becoming chronic and inflammatory. So in those cases, working with a practitioner to test for and ideally treat, that is valuable.
All right. So it sounds like it's never totally eradicated from the body.
Right. Yeah. And, like many viruses, like chickenpox virus, you get it, it stays in your body lifelong. Epstein-Barr virus is the same. But for most people, that's not a problem. The immune system keeps it in check and prevents it from reactivating. So it's only when it becomes chronic, reactivated, which is a result of immune system dysregulation, that it becomes problematic.
And the other piece I want to talk about is Lyme disease. This is something that seems very mysterious, getting a lot more attention, it seems, in the health and wellness space lately. How do you feel about that? And how often do you see people with autoimmunity being affected by it?
Yes, I think it's a very important topic. It's one that I also write a lot about in the book because I think Lyme disease is very underdiagnosed. In the mainstream, we talk about, you get this bullseye rash and fevers. But studies show that, the majority of people who get Lyme disease don't get this classic bullseye rash. They may not even have any rash. And so many people don't realize they've been exposed to Lyme disease or infected with it. And so I do see in a significant minority of my patients with autoimmune disease that untreated or undiagnosed Lyme disease can be one of those chronic infections that drives inflammation and drives autoimmunity. So it is important to work with the practitioner if you're suspecting that.
And for somebody that's had that infection for a long period of time, it's become chronic. How do you work with a patient in that realm? The way I understand it is if you catch it early on, you can treat it with antibiotics and eradicate it. But for somebody that finds it later, they have a chronic infection, I'm sure there's nuance depending on the patient, but is there hope once it becomes chronic of clearing that from the body?
I think, yes, there is hope. It is not easy or straightforward. Often it's a slow process that takes months or years. We have had some success using botanicals, like herbal therapies that are antimicrobial. Usually you have to use multiple ones in combination, but over time they can bring down the levels of Lyme bacteria. And then if that doesn't work, we usually refer people to physicians trained by the International Lyme and Associated Diseases Society, called ILADS. And in those cases, they are trained in more longer term use of antibiotics, which, of course, we don't want to use them because of risk of the microbiome being disrupted. But in certain patients, the damage caused by an infection is much bigger and more important. And in that case, the benefits outweigh the risks of those longer term antibiotics.
For somebody that has a need to go on antibiotics, whether it be for Lyme or something else, what do you recommend to them before they take it, during and after, to try and preserve the microbiome?
Yes. So I think the foundation is really fermented foods and prebiotic foods. So definitely trying to increase the intake, before, during, and after, because that's the key way to support the microbiome. I think this is where certain probiotics do have a role to play. Like, for example, the Saccharomyces boulardii or the Florastor or other brands. That beneficial yeast is not killed by antibiotics. So you can take it, at the beginning when you begin a course of antibiotics, it won't be affected by that drug, but it will help keep the bacteria in a good place so that your microbiome can recover more quickly once you complete the antibiotics.
Got it. Okay, so we'll move beyond infections now. We've already gone deep into the next driver, which is gut health. We've talked about the prebiotics, the probiotics, the postbiotics, eating a diverse range of different types of fiber to feed that microbiome, trying to get diversity within the plants in our diet. Anything else we want to add to that when it comes to autoimmunity?
Um, yeah, I think with gut health, I think the dysbiosis is one of the key hallmarks of autoimmunity, and what that is an imbalance. So, in a healthy microbiome, your good bacteria are abundant, and they outweigh and prevent harm caused by any of your opportunistic bacteria. It doesn't mean those bacteria are gone or eradicated. They're there in small quantity. That's normal. They're kept in check by the good bacteria. They don't cause harm. But dysbiosis is where the process is flipped, and you get an overgrowth of those opportunistic bacteria, decline in the good bacteria, and then you start seeing the inflammation, the immune dysregulation. Dysbiosis has been linked to not just autoimmune disease, but fatty liver as well, metabolic issues, obesity, other chronic diseases. So I think dysbiosis is a really big driver, and it is one thing that is much more likely to happen when that stool pH goes too high, and that's why keeping that stool pH more acidic helps to prevent dysbiosis. And scientists are identifying unique dysbiosis signatures for each autoimmune disease. So this is very exciting, current active area of research, because different autoimmune diseases seem to have different patterns of dysbiosis, and those are being teased out right now.
Oh, that's fascinating. And I think this is a good area for us to talk about the endotoxin LPS.
Yes.
Let's talk about when that's within a normal range and when it becomes problematic, and specifically start off with what that is.
Yes. So LPS is lipopolysaccharide, which is a compound that is found on the cell walls of certain bacteria called gram-negative bacteria. So that just refers to a staining method, but there are two categories of bacteria: gram-positive bacteria, which are often the beneficial bacteria, and gram-negative bacteria, which are the opportunistic bacteria that can overgrow, that are inflammatory. So if you get the dysbiosis, where you have more of these opportunistic gram-negative bacteria, the LPS, which is produced on their cell wall, is secreted into the intestine. And then, if you have leaky gut, as typically people do, slips into the bloodstream, where it is highly inflammatory because the immune system is primed to respond to even low levels of LPS. Because when you have sepsis, which is a life threatening bacterial infection, LPS levels get really high. So the immune system reacts strongly to LPS. And as you start getting higher and higher levels in the blood, you get more inflammation and more significant immune dysregulation.
Okay. And when it comes to keeping that in check, is it just about all the things we've been talking about to maintain healthy gut? And obviously, we need to, if there's leaky gut, we need to address that.
Yes, I think, yeah, all the things we've been talking about, plus another strategy that is really beneficial is use of spices. Because, we have to remember that before we had refrigeration or other methods of preserving food, spices were what kept our food from spoiling. And they did that by, killing or preventing the growth of bad bacteria. So they do the same thing within your microbiome. So boosting intake of spices can really be beneficial antimicrobial. And some of them, like, for example, ajwain, Ajawain, is a spice that is used a lot in Indian cooking, in Ayurveda, and it's selective. So studies show that it did not impact the growth of beneficial bacteria, but was able to reduce the growth of pathogenic bacteria. So I think spices are a powerful tool.
Okay, moving into the next driver is eat right, and we've talked deeply on the food piece. One area that ties into that I'd like to get deeper into is supplements. We talked about probiotics, but let's talk about other supplements somebody with an autoimmune condition might want to include with all the dietary stuff we talked about before to ramp things up.
Yeah, so I think there are maybe 4 supplements we can talk about at a high level that I think are very important in autoimmune disease and chronic inflammation. One is vitamin D. So we know vitamin D is actually a hormone. It impacts not just your bone health, but your immune system, your inflammation levels, your brain health. So and checking vitamin D levels is the only way to really know for sure whether you're getting enough. Because for some people, they need a much higher dose of vitamin D supplementation. Others can get it through sunlight or not take high doses. And as long as you're getting your vitamin D levels in a good range, that makes a big difference in autoimmunity. Second would be omega 3 status, which can be measured with a blood test called the omega 3 index that is through most labs. So you have 2 main kinds of fatty acids, omega 3s, which are anti inflammatory, and omega 6, which is more pro inflammatory. And omega 3s are found in fish, seafood, flax seeds, chia seeds, a few foods like that. And so fish oil is something that is a good option if you're not able to get omega 3s, because it really makes a big difference for the inflammation. And then third, I think I have to talk about curcumin, because I'm a big fan of turmeric, but curcumin is a form of it that is much more better absorbed. And in that case, supplement can really ensure that the turmeric is getting into the bloodstream, into the joints, or wherever the tissue is you want it to work. There are many forms of curcumin now that have multiples, like better absorption, 100 times better absorption than regular turmeric. So that's where doing a curcumin supplement can be helpful. And then finally, I'll mention glutathione, because it's just the most important antioxidant in the body. It supports detoxification. We talked about how autoimmune patients tend to have low levels of glutathione. And there's 2 forms of glutathione. There's a liposomal and reduced, both of which have been shown to be effective at raising intracellular glutathione. So liposomal is where the glutathione is packaged into a fat molecule called a liposome that is better absorbed. And then reduced glutathione is a different form that is also well absorbed. So other forms of glutathione don't get absorbed orally that well, but those are 2 forms that are good, and glutathione can be a really foundational supplement as well.
That's great. And when it comes to the big 4 you just mentioned, are those ongoing, or is it more something you'd want to include early on and then consider weaning off?
Yeah, it really depends. I think vitamin D is the one that I believe is long term, because it's hard. Usually, if you don't, if you stop taking for a while, the levels start to drop unless you're just getting tons of sunlight every day. Vitamin D, I believe, is really more of a long term supplement. With fish oil, I think it can be great in the beginning to boost up your levels, and then hopefully you're increasing your intake of foods rich in omega 3s like fish and flax seeds and chia seeds, and that will help maintain it, so you don't necessarily need to be on it long term. Curcumin and glutathione, I think those are both dependent on the practitioner. Maybe they're trying to bring down inflammation in the beginning or support detoxification. Can be great for upfront usage, but long term, using turmeric, using spices, and then using foods to support your glutathione, like cruciferous vegetables and the beet greens from beetroot. Those are my favorite long term strategies.
I totally agree with you on the vitamin D. That's something we need to continue to monitor and keep in that healthy range.
Yes.
I think this would be a good place to talk about adaptogens. You mentioned astragalus before. I believe that fits under that category. But what these are known for is modulating the immune system, which is the thesis of what we're talking about today. So, how do you feel these have a role within treating autoimmunity?
Absolutely. So adaptogens are herbs that help your body adapt to stress. And some examples of them are ashwagandha, ginseng, rhodiola. Those are probably the three that I use the most often. And ashwagandha is an Ayurvedic herb that also is anti inflammatory, but is excellent for stress. It reduces anxiety. It's one of those few herbs that increases energy and also calms the person. So, unlike caffeine, where you might feel wired or something like that, but it's calming and energizing at the same time. Rhodiola is similar in property. That's a so, for example, ashwagandha should be avoided in people with hyperthyroidism because it stimulates the thyroid in a good way if you have Hashimoto's or hypothyroidism, but can be problematic if you have hyperthyroidism. Rhodiola does not have that same issue, and it's a great alternative. It's very good as well for mood, supports, in fact, some people use it as an antidepressant. It really uplifts mood. And ginseng is another option as well, especially if you're seeing a Chinese medicine practitioner. They often use ginseng as their adaptogen.
All right. And then the last piece of the Tiger Protocol, rest. And I want to start off talking about rest with sleep, which is a pretty obvious piece of that. I know you're a big fan of getting quality sleep for somebody that's battling with an autoimmune condition. Talk about why that's so important in that case and what you recommend for them.
Yes. So yeah, I think the rest component is really vital. So with sleep, I think that that is when our body heals. So that's when it repairs damaged tissues, it regenerates. So that's so important for people with autoimmunity because if you're not really getting enough sleep, you're not giving your body the time and space that it needs to heal because it really does that during the process of sleeping. It varies a lot in terms of what people need. That's optimal, between 6 to 8.5 hours. So the main way I tell people to judge it is if you wake up feeling well rested and you're not drowsy or sleepy during the rest of the day, then that means you've had enough sleep. And for each person, that might be a different number of hours, but that's a good guideline for sleep.
And do you feel like for somebody who's at least in the early on part of their journey with battling an autoimmune condition, they should be upping that sleep beyond that range you just talked about?
I think it can be helpful, certainly because sleep is really when all the body's healing pathways kick into high gear. So if you want to maximize that time, especially early on in the process, I think that would be highly beneficial.
All right, let's talk about some of the other things. Other than sleep, what can we do to make sure we're getting that rest and letting our body replenish like it needs to?
Yes, so I think addressing stress is really the big one. Another factor which we can come back to is addressing trauma, like especially even childhood trauma has been associated with autoimmunity. But with stress, like everyday daily stress, studies have shown that is associated with the development of an autoimmune disease and also associated with flare-ups and exacerbations of autoimmune disease. So at every stage, it's important. And finding a technique that works for you to manage stress is the important thing. Of course, I'm a big fan of meditation. It's got a lot of research for neuroplasticity, how it helps your hippocampus to get bigger, boosts your gray and white matter. It helps your focus and productivity. It prevents the age-related atrophy or shrinking of brain cells. So a lot of benefits of meditation, but it's not for everyone. And there are other tools in the literature that have been shown to be helpful, like psychotherapy, counseling, prayer, gratitude practices, forgiveness practices, going out in nature. For some people, journaling or exercise can be really, stress relieving. So find something that you enjoy and that you can do regularly, and that will address that mind body axis and help you manage your stress, because it is really one of the biggest under emphasized factors.
Let's talk more about that exercise piece, because the way I see it, there would be a U, you mentioned with salt, there's this U distribution where we want to find that sweet spot in the middle. I would assume for somebody with an autoimmune condition, when it comes to exercise, that would be especially important. They don't want to not move their body, but they also don't want to push it because their body is healing and going through this healing process. So for somebody that wants to adopt or modify their exercise routine as they're fighting an autoimmune condition, how do they find that sweet spot?
Yes, that's a great point, because, I often see in my patients with autoimmune disease, sometimes too intense exercise can actually be counterproductive and worsen symptoms. If they're doing a lot of like high intensity interval training or CrossFit type workouts, and, they have a busy job and 3 children, and, life is very stressful as it is. In those cases, can be counterproductive. So with exercise, I always tell people that they should feel energized when they have completed it. Maybe like a little fatigue because of the exertion, but in general, it should not be something that you feel wiped out afterwards. If you do, that means that it's probably too much intensity, too much duration. So you have to find that moderate amount. And with exercise, I think 3 components are important. One is cardiovascular, so for the heart, getting at least that 150 minutes per week of walking, jogging, swimming, running, cycling, anything like that to get the heart moving. That's critical. Second is resistance training. This could be at least twice a week, either home body weight exercises like push-ups, doing a plank, or those things, or you can use weights or resistance bands or Bowflex. There's a lot of ways, but resistance against your muscle movement, that is very critical. And then the final piece, which often is overlooked, is balance and flexibility. So yoga is my favorite tool for this. Other options are, Tai Chi, Qigong, Pilates. But at least twice a week, I recommend people engage an exercise that helps their balance.
And when I think about exercise and putting that stress on the body, a good stress, but a stress, it gets me thinking about some of the other things we've talked about to this point: fasting, using a sauna. And I could see how for somebody that tries to adopt all these and do them within a narrow time window, they could go beyond the healthy stress threshold by overlapping these different stresses. Even though they're healthy, putting too many of them too close together, I could see how that could be too much for the body.
Yeah, that's exactly right, because stress is cumulative, and to the body, it doesn't matter if it's coming from fasting or exercise, or the diet. Anything that is causing stress adds up. And the way that all these approaches work is through hormesis, which is the mechanism by which a beneficial stress damages the body temporarily, but then when the body heals, it comes back stronger and more resilient. So just like when you're lifting weights, you are slightly damaging the muscles, and that's how they grow, when they heal and recover. So with hormesis, if you get too much stress and combine like multiple different stressful things on the body, then it gets to the point where you don't get that benefit. So it can be counterproductive. So often, like that's why I see with intermittent fasting, especially in some of my female patients who have very busy, multiple roles, mother, busy professional, and plus other activities, then intermittent fasting is counterproductive, because it is one more stress that then has negative effects for a person who's already stressed.
And how do you feel about using something like HRV as an objective measure to see how your body's responding to these different quote unquote healthy stressors and seeing where you're at on that continuum?
Oh, yeah, that's a great tool. I think heart rate variability is a pretty good metric for how your sympathetic and parasympathetic nervous systems are in balance. The sympathetic is more fight or flight, and parasympathetic is resting, digesting, rebalancing. And research shows that patients with autoimmune disease tend to be low in HRV, and that reflects typically higher sympathetic activation and lower parasympathetic. So as you incorporate more of those mind body techniques, tracking your HRV through either a watch or a Aura Ring or other devices like Heart Math, there's a lot of different ways to track it, but that can be a valuable tool.
And when you talk about the nervous system, it gets me thinking about the parasympathetic nervous system, which ties into what we're talking about here, the rest and digest, and the vagus nerve, and stimulating that to cause that calming of the body. So can you talk about that nerve specifically and the physiology of stimulating that to cause that calm?
Yes, absolutely. Yeah, the vagus nerve, vagus means wanderer in Latin because this is one of the longest nerves in the body, starts in the brain and kind of wanders, meanders throughout the whole body. So has really widespread effects and is probably the main nerve for the parasympathetic nervous system, which is this beneficial rest and digest approach. And most mind body techniques work through activating the vagus nerve and parasympathetic pathways like meditation, guided imagery, relaxation, deep breathing. But there are other like kind of hacks you can do to activate the vagus nerve. So cold water exposure is actually one of the powerful ways to do that, especially on the face. Cold, but to the whole body as well. But acute cold exposure really stimulates the vagus nerve. And then finally, I'll mention there are now vagus nerve stimulators that are implantable, which are being studied for autoimmunity. Very good initial research in rheumatoid arthritis, Crohn's disease. These devices are getting smaller and more effective with each iteration, but I think that might be a tool down the line that our patients with autoimmunity can benefit from.
It sounds very invasive, though, the fact that it's
Yes.
implanted instead of just something you can use and then put aside.
No, it is certainly invasive, and it's studied in patients that are drug refractory. So they've already tried like multiple medications for their autoimmune disease, not able to get it under control. But in those cases, it might be worth doing something like that to help bring their symptoms into remission.
Got it. And you mentioned the cold water therapy. A great way for people to get started with that would be to end their shower with cold water. I've done this on and off over the years. It's one of those things that I found it hard to make it a regular practice ongoing because we can't deny the fact that it is very challenging. It's very painful, but ending that shower with 30 seconds of cold water would be a way for people to get started.
Yes, absolutely. Yeah. So it doesn't need to be like a full ice bath or, many of these like devices that are there now, like a cold plunge. You can even, if you are in the winter time, you can go outside without, a jacket. You get the acute cold exposure that way, or the shower. That's one of my favorite ways as well. Just 30 seconds of cold water at the end of a shower.
You mentioned trauma and mentioned that we could come back and go deeper into that. A lot of people, when they hear that word, probably think about things like physical abuse, sexual trauma, these big capital T traumas that, do happen, unfortunately. But let's talk about the continuum of trauma and how that can specifically impact somebody with autoimmunity.
Yes, for sure. So there are many different types of trauma. What has been studied are adverse childhood experiences called ACE scores, which have been, associated with dramatically higher rates of adult autoimmunity. So these could be things like, abuse or neglect or other challenges in childhood. But what the mechanism is chronic sympathetic activation. So what they find is the trauma, activates this fight or flight response, and if it's severe enough, then it can persist for decades, and over time, that leads to the inflammation and autoimmunity. So I think one of the tools for addressing trauma that is showing a lot of research is EMDR, eye movement desensitization and reprogramming. This is a technique using eye movements that have been associated with different brain effects, and research on trauma is very promising with with incorporating that. I agree. I think other forms of trauma are more subtle. So, for example, racism, and this is why there are racial and ethnic disparities in autoimmunity. I think it's important to be aware, that especially underserved populations, they have worse outcomes when it comes to autoimmune disease. And it's thought it's because of these negative effects of structural, inequality, racism, all of those things over time, can contribute to that sympathetic overactivation that leads to inflammatory changes.
For somebody that's tuned into this point, they're dealing with an autoimmune condition. They're feeling worn out. They've, tried a lot of different things. And now they're feeling overwhelmed because we've shared so much great information, but it might seem like a lot to a person, especially if they're not feeling very good right now. What I'm getting at with this, what are the biggest needle movers for somebody to adopt right away to start building that momentum, start feeling better, and then over time, they can continue to adopt a lot of the nuanced things that we're talking about today?
Yes, absolutely. And it is true. Many of our autoimmune patients feel overwhelmed. They have a lot of symptoms. They're in pain. They're not ready to make like many different changes. So I always suggest in those cases starting with two things. One is some way to reduce toxin level, whether it be adding a sauna, or switching your diet to more organic, or just one step, because we know the toxins are such a big factor. And if you start with just one change there, that can build positive momentum. And then the second area is pick one thing to address stress, because, that's part of everyday living. We can never get away from it, but it's often under recognized, and it can have a really positive impact on quality of life, on sleep, anxiety, depression, mood. A lot of other benefits occur when you intentionally practice a stress reduction technique, and it will start to help your autoimmunity as well.
I feel like a lot of the people that are going to find this conversation and are going to tune into this point have likely been dealing with an autoimmune condition for a long period of time, maybe tried different conventional treatments, different natural things they found on the internet, and they're starting to lose hope.
Mm-hmm.
Talk to that person right now that's feeling stuck and feeling like they've tried so many different things and nothing's going to work for them.
Yes, I do see a lot of these patients in my practice because we're a referral center. People often see other integrative doctors as well before coming to us, multiple specialists. So what I tell people is that the body always has the potential to heal. And so for that reason, a person always has the capacity to feel better. Doesn't mean that the disease is going away or it's going to be cured, but remission, which is that state of balance, is always something that can be moved towards. And I've had many patients tell me, I'm the first doctor that's told them they could feel better. And the power of your mindset is so huge. So having that belief that you can feel better, and to know that it's possible, is very empowering. Because in conventional medicine, we often focus on the statistics that these diseases are incurable, and people may get the message that they cannot improve or feel better. And I think that's inaccurate, because there are these steps that can empower people to begin slowly to feel better.
And Dr. Akil, I feel like at this point is a good time to tie your story into the hope piece. And your health journey, where your health made a turn for the worst, began about 20 years ago. You're in med school, you start developing this mysterious illness, and you get to the point where you can't even continue your education.
Right.
So take us back there and what you went through, and then we'll go through what you did to come out of it.
Yeah. So that was during my, medical training where I developed this mystery illness with joint pains, severe fatigue, weight loss. Of I'm already like fairly lean person, unintentional weight loss, and then I was not able to sit in a chair or use a computer. So I literally had to stop my training, take a year off, because the conventional therapies like physical therapy, anti-inflammatory drugs were not really solving my issues. And so during that year, I had to go on a quest to heal myself so that I could even just, finish medical school. And that was the first time I was really exposed to many of these integrative medicine modalities. Saw an Ayurvedic practitioner in San Francisco. I met with a functional medicine practitioner. Those two were probably the biggest modalities that helped me recover my own health. And then I decided, I wanted to get trained in those modalities and integrative medicine to help my future patients.
And what was your diagnosis at the time? Was this an autoimmune condition?
No. So, I think in Ayurveda, that was probably the closest that I got because I didn't really have a Western diagnosis. I didn't have, autoantibodies or blood markers. But in Ayurveda, there's three forces called doshas that are necessary for balance. One of them is vata, which is wind. And vata dosha excess was what the Ayurvedic practitioner diagnosed me with. That is often caused by stress. And it can cause many of the symptoms that I was experiencing, such as the fatigue, body pain, dry skin, constipation. All these things that are seemingly unrelated, but I think that are reflections of this deeper imbalance. And yeah, that was the first step in my healing was working on balancing the vata dosha, and I just started to see so much benefit from implementing those changes.
And what were some of the specific things you were doing to balance that dosha?
So, having bone broth was actually something my Ayurvedic practitioner recommended. This was before bone broth was a fad, and I had actually switched to a vegetarian and nearly vegan diet for about 3 years before I got sick. And my Ayurvedic doctor said that diet depends on your body type, like what your constitution is. And for someone with vata, which is in my case, my constitution, it's actually recommended not to be vegetarian or vegan, but to include some animal protein in the diet. And she suggested starting with bone broth, which is gut healing, very deeply nourishing. So that was one of the key steps. Secondly, I did reincorporate some animal protein like wild caught fish and pasture raised chicken, and I just really started feeling a lot better. And then finally, another strategy that she had me do was oil application to the skin, because Ayurveda believes in the effectiveness of these techniques called abhyanga, which is basically like skin, like oil massage, but it doesn't need, it can be also just applying oil to the skin like you would apply lotion. And there's different oils for each dosha, but for vata imbalance, sesame oil, unrefined organic sesame oil is the best. And so that's what I would slather on my body, once a day, every day. And it would be absorbed within like, half an hour because my system was so much in need of that. And that's another way as well that vata can be balanced.
And how long did it take you before you felt like you're back on your feet?
Well, it did take the whole year. So I started seeing improvements right away, but the process, yeah, was a good 9-10 months. And so by the end of that year, though, I was feeling better than I had ever felt, and I felt like I knew what to do to maintain my health. More importantly.
You just touched on bone broth, and we've touched on leaky gut. I want to make sure before we part ways, we really hit this part home. The leaky gut connection to autoimmune conditions and how that is so essential and integral physiology wise to leading to the autoantibodies and really ramping things up in a negative way.
Yes, absolutely. So just like we talked about dysbiosis, which is the hallmark of most autoimmune diseases, whenever they've studied an autoimmune disease, they have found that leaky gut is present if that's what they're investigating. So I think it's also one of those foundational mechanisms. And treating leaky gut, we know the bone broth with the gelatin is very powerful. And glutamine, like in cabbage juice or supplement form, can be really helpful. And then all those short chain fatty acids help normalizing leaky gut. So getting those prebiotic foods, getting those fermented foods, all of those help with healing leaky gut.
And then let's get into the details about molecules when we do have leaky gut going through and then forming those autoantibodies.
Yes, exactly. So, molecular mimicry is one of the mechanisms that explains how autoimmune disease develops. And what it is that the proteins on certain bacteria or other microbes mimic the proteins in our human cells, and our immune system can't tell the difference. So, if it makes an antibody against for example, candida surface antigen, sometimes that can cross react with the beta cells, so the insulin producing cells of the pancreas. And then those are the same antibodies that are used to fight the candida end up damaging the cells or tissues. And in that case, you'll get type 1 diabetes. So with molecular mimicry, it's much more of a problem when you have leaky gut, because then, you have entry into the bloodstream of many more bacteria, viruses, mycobacteria, all different types of microbes. And so you have much higher antibody production and much higher risk of that molecular mimicry affecting one of the tissues in the body.
Dr. Akil, really enjoyed this very in-depth, thorough conversation. We're going to link up your social media, your book, everything in the show notes, your website. I just want to thank you for coming on the show and sharing all your knowledge and the details here. This is going to be really helpful for a lot of people, so thank you.
Oh, thank you so much, Jesse, for having me on the podcast. And I really enjoyed our conversation as well. So thank you for that.
Now that you're done my conversation with Dr. Akil, you're going to want to stick around here and catch my chat with Dr. Gundry. He's going to teach you the foods you need to eat to stay young. I'll see you over there.
When you start looking at what all of these health things do, it all comes down to just